Assalamualaikum and good morning, everyone. Today, my lecture is about the anatomy of nose and paranasal sinuses. This is the lecture outline. The first part will be discovering about the nose, which are the external nose, the nasal cavity, the medial and lateral nasal wall, and then we go to the paranasal sinuses. Okay, what is the function of nose? Okay, there are many functions of nose. Basically, just two functions. First is the organ of smell. Okay, as all of you know, nose is an organ of smell. Okay, of all the area in the nasal cavity, organ of smell occupy the upper 1/3 of the nasal cavity. This is known as the olfactory mucosa. Secondly, the nose is as a respiratory passage whereby the rest of the cavity are lined by respiratory mucosa. And the area of the nose is area which cover the respiratory mucosa are highly vascular. So the air that is inspired will be warm within the nasal cavity before it enters the next part of the respiratory system. The area of the respiratory passage also contains numerous serous glands. This make the air moist, and it also used to trap dust and other particles. So it's clean the air and help. Okay, let's talk about the external nose. Okay, this is the external nose. Okay, it's part of the nose that are visible. It varies in size, and mostly the variation is due to the size of the cartilage that are forming the external nose. Okay, anatomically, the nose can be identified as dorsum. The dorsum, which extend from the root of the nose until the apex of the nose. So this is dorsum. The nares, the nares is the opening under ala. Nares and ala, the lateral boundaries of the nares. Okay, yeah, just a revision. This is dorsum of the nose, dorsal part of the nose, the apex, extend from the apex apex to the root of the nose, and then it has the nares, which is known as the opening of the nose, and the ala, the boundaries of the opening of the nose. The external nose is made of skeleton, which can be divided into the bony skeleton and the cartilaginous skeleton. What are the components of the bony skeleton of the external nose? They are made of three types of bones, which are the nasal bone, frontal bone, and the maxilla. So the nasal bone, a pair of nasal bones, and the frontal process of maxilla, and the nasal process of frontal bone. Okay, these are the bony skeletons that made up of the external nose. Okay, first is the nasal process of frontal bone. Okay, and then we have the nasal processes of maxilla and nasal bone. Okay, next part is the cartilaginous part of the external nose. There are 5 cartilages that form the external nose. Okay, one of it is the septal cartilage in the middle, and on the lateral, there are 2 lateral nasal cartilages, right and left, and we have major alar cartilages, right and left, minor alar cartilages, right and left, and a sesamoid or accessory nasal cartilage. Okay, for the major alar cartilage, it is made of lateral and medial crust. So, major alar cartilage consists of lateral crust and medial crust. Okay, just a revision again. This is the lateral nasal cartilage, the nasal septal cartilage, and the major alar, minor alar, and this is the accessory or sesamoid cartilage. Okay, for the major alar, it consists of medial and lateral crust. A, lateral, B, medial. All right, a arterial supply of the external nose can be divided based on the area of the external nose. For the alar region, it is supplied by the lateral nasal branch. This one, lateral nasal branch, is a branch of facial artery. And then for the lower part of the septum, it is supplied by the superior labial branch of the facial artery and the dorsal nasal branch for the lateral part and the dorsum of the nose, supplied by two type of uh, artery, the dorsal nasal branch of ophthalmic artery, dorsal nasal branch of ophthalmic artery, and infraorbital branch of the maxillary artery. So the nose is supplied by facial artery, ophthalmic artery, and the maxillary artery. They are branches. All right, this is the picture showing the facial artery. Facial artery that give of two branches that supply the external nose, particularly the alar and the lower septal area, which are supplied by the lateral nasal and the superior labial artery, the two branches of facial artery. And then you have the infraorbital artery that supply the lateral part of the nose. The infraorbital artery is the branches of maxillary artery. And we have the dorsal nasal artery, which supply the dorsum of the nose, which are the branches, the branch of ophthalmic artery. Okay, for the innervation, muscular innervation of the nose, external nose is by the facial nerve, which branch, with which division, the zygomatic branch of the facial nerve. You must, well, for just for your information, for facial nerve, it has 5 branches. I know you. I know you already learned this in your nervous system. So you must remember what are the branches of facial nerve. One of it is the zygomatic branch, which supply the muscular innervation for the external nose. What are the muscles and movements that present at the external nose? Okay, these are all the muscles that present in the external nose. Okay, you have procerus up here, you have anomalous nasi, and you have these transverse nasalis up here, and then in the alar, you have compressum narium minor, dilator naris anterior, and ala nasalis, and the longest name that ever present in animal, the name of muscles is the levator levi superiorus alechnasi. Okay, the longest name of any muscle in animal. So this the two of the example of movement that are present in the by the muscle, produced by the muscle around the external nose, where this movement is by the contraction of the procerus up here and transverse part of nasalis. Okay, transverse part of nasalis. And when you make this movement, okay, kembang hidung, okay, the muscle that is doing Their job is the levator labii, superior alecnoside, and anal part of nasalis. All right, the sensory innervation of the external nose consists of three nerves. The ophthalmic nerve for the dorsum sensory external part, and maxillary nerve is for the alar region, while the internal part where the nasal cavity is by olfactory nerves. Okay, so the nose has three sensory innervation: olfactory nerves for the inner or the nasal cavity, and ophthalmic and maxillary nerve for the external nose. Now we go to the nasal cavity. So this is the nasal cavity. The floor is here. Sorry, the roof is here. The floor, the nares, the opening, and coena. Coena is actually the opening of the nasopharynx. Remember our pharynx, it has three: nasopharynx, oropharynx, and laryngopharynx. So the nasopharynx, opening of the nasopharynx is known as coena. All right. Okay, let's go into detail about the boundaries. The bones that form the boundaries of the nasal cavity can be divided into roof, the floor, the medial, and the lateral wall. For the roof, the bones of the skull that form the roof of the nasal cavity are the nasal bone, the frontal bone, the ethmoid bone, and the body of the sphenoid bone. For the floor, it is made of the palatine process of the maxilla. So this is the maxilla, palatine process, and the horizontal process of the palatine bone. So there are only two types that form the floor. While for the medial wall, the nasal septum is formed by the septal cartilage, the isthmoid bone, which is the perpendicular plate of the isthmoid bone, and vomer. While for the lateral wall, there are so many structure: the nasal bone, the maxilla, the isthmoid bone, superior and middle nasal concha of the isthmoid bone, and the inferior nasal concha is a bone of its own, and the perpendicular plate of the palatine bone. All right. And now we go to the okay. These are the list of the boundaries, list of the skeleton, the bony and the cartilaginous skeleton that form the boundaries of the nasal cavity. Well, you have to at least know one or two type of the skeleton that form the roof or floor, the medial and lateral wall of the nasal cavity. Now go to the regions of the nasal cavity. Nasal cavity can be divided into three regions: the nasal vestibule, the chemosensory olfactory area, and the respiratory region. Okay, the nasal vestibule is this area. This part of the nasal cavity is the nasal vestibule. Okay, it is lined with the skin. Okay, not mucosa. The inferior region of the nasal cavity, it has sebaceous and sweat gland and vibrissae, a coarse hair that occupying the nasal vestibule. Only small region, a small part of the nasal cavity is hairy. Okay, so this region is known as nasal vestibule. So it is lined with skin, so that when we clean our body for mandi wajib, for Muslim we have mandi wajib. So this area of the nasal cavity must be clean too, because it is just part of the skin. It's part of the skin. All right, so don't miss this activity. You have to clean the inner part of your nose if you are performing the mandi wajib. And then second region is the olfactory, chemosensory olfactory area. Okay, this region, okay, the blue shade area. This region consists of peripheral receptor for olfactory sensation, for smelling lah. All right. Olfactory neuroepithelium contains sensory nerve ends at its mucosa. So this is the chemosensory olfactory area. So vestibule here. Second region is chemosensory olfactory area, and the third is the respiratory region. Beside the previous two regions I explained, the rest is respiratory region. All area of nasal cavity except vestibule and olfactory region is known as respiratory region. This mucosa is continuous with the nasopharyngeal mucosa back here, conjunctiva of the eye, and mucosal lining of the paranasal sinuses at its lateral wall. We are going to talk about this later on. And concave is this structure, the elevated surface area of the lateral nasal cavity. It has high turbulence to slow down inhale air to improve olfaction. So one olfaction, second humidification, and third is warming of inhale air. Okay, let's go into the middle wall of the nasal cavity. What are the structure that present in the medial wall? Okay, medial wall. It is formed by this skeleton, the septal cartilage, the ethmoid bone, and the vomer. Okay, so in the nasal septum or medial wall, it is supplied by all these four type of arteries based on the region for this area. So this area, which is the posterior inferior quadrant, okay, is supplied by the branches of sphenopalatine artery. For the anterior superior region is by the posterior and anterior ethmoidal arteries, while for the anterior inferior portion or region quadrant is by the greater palatine artery, and for the vestibular area is by the septal branch of superior labial artery, which is the branch of the facial artery. Also in the middle of this area, it there is a region which is known as Little's area. All right, these are all the attributes that I have explained in the previous slide. So a bit about clinical anatomy of the nasal septum or medial nasal wall. This is the medial nasal wall. A condition called a deviated septum is known is present when nasal septum is significantly off-centered or crooked or making breathing difficult. Most people have some sort of imbalance in the size of their breathing passages. Estimates indicate that 80% of people most unknowingly have some sort of misalignment of their nasal septum. Even me, I have misalignment or maksudnya tak seimbang lah. The right opening is much more bigger than the left because we have some degree of deviated nasal septum. But it is significant. If it is significantly causing our breathing problems, the surgical treatment is required. Another condition, another clinical anatomy is, as I mentioned earlier, this is Little's area or clinically it's also known as Kieselbach area. Okay, this is the area of where arterial plexus formed by all the blood supply of the medial nasal septum. This area is located 1 centimeter above the nasal floor. Okay, approximately 1 centimeter above the nasal floor, 1 centimeter behind the anterior end of the vestibule. So this is the little area. And all the plexus that form at this area is formed by the vessel that's supplying the nasal septum. This is the potential bleeders from anterior epistaxis. What is epistaxis? It is nose bleeding. So that's why when you have your family member with the incidence of nasal epistaxis, you can actually just press this area just by pressing your nose and ask the person to breathe through your mouth. So like pressing will somehow will stop the bleeding if the bleeding is not that serious. Okay, that is all about the medial wall. Now we go to the lateral wall of the nasal cavity. It is, as I mentioned, is consists of concave elevated surface area. We have three concave, nasal concave, superior nasal concha, middle, and inferior nasal concha. Okay, this is superior nasal concha. Superior nasal concha, middle nasal concha, and inferior nasal concha. Below the nasal concha, there is actually a meatus, superior nasal meatus, middle nasal meatus, and inferior nasal meatus. Okay, superior nasal concha is this. Is a small curved medial process of the ethmoid bone. Right, it's from the roof of the superior nasal meatus. So remember, superior nasal concha is formed by the medial process of ethmoid bone. This nasal concha form the roof for the superior nasal meatus. For the superior nasal meatus, it has the opening for the posterior ethmoidal cells. Posterior ethmoidal sinuses open at the superior nasal meatus. All right. Okay, the middle nasal concha. This one, the middle nasal concha is a medial process of the ethmoid bone. It's from the middle nasal meatus. It's from the roof for the middle nasal meatus. All right. What are the structures that open into the middle nasal meatus? There are four structures that open into the middle nasal meatus. First is the frontal sinus. Okay, frontal sinus. This one. All right. Second is interior ethmoidal sinus, and middle ethmoidal sinus, and maxillary sinus. Middle, anterior, and maxillary sinus. All right. Inferior nasal concha is this one. It is made of the inferior nasal concha bone itself. This bone articulates with the nasal surface of the maxilla and the perpendicular plate of the palatine bone. They attach or articulate at these two types of bone of the skull. Inferior nasal concha is present below the inferior nasal concha. Inferior nasal meatus is present in the inferior, below the inferior nasal concha. It is there is an opening for nasolacrimal ducts present in here. All right. Now is the venous drainage of the nose. It is the blood that from the nose area will drain into facial artery, into the ophthalmic vein, and eventually to the cavernous sinus. So this area is known as the danger triangle of phase. So because they drain into the cavernous sinus, which is located in intracranially, so any infection of this area, if it is uncontrolled or untreated, may lead to brain infection through the cavernous sinus drainage. Okay, now the lymphatic drainage of the nose can be divided into anterior and posterior region. For the anterior region, they drain into the submandibular nodes, while for the rays of the nasal cavity, paranasal sinuses, nasopharynx, and pharyngeal, they open into the cervical nodes, the upper deep cervical lymph nodes, the drainage into the cervical nodes. Okay, I think that's all about the nasal cavity. Now we go to the paranasal sinuses, the sinuses. What is paranasal sinuses? There are few spaces located within the bone of the skull and face. They're located around the nasal cavity and they open into the nasal cavity. The functions of the nasal cavity, paranasal sinuses include the lightening of the weight of the head, humidifying and heating inhaled air, increase the resonance of speech. Yeah, if we don't have the paranasal sinuses, we might not be able to lift our head up because of the weight of the skull we have. Okay, so the paranasal sinuses really significantly lighten the weight of the head. They humidify the heating inhale air. Because the paranasal sinuses has the mucosa full of glands that lining it. And they also help in speech. They will increase the resonance of speech. So that's why when you are having flu or sinusitis, you will have changes in your speech resonance. Okay, there are four paranasal sinuses: the frontal sinus, the ethmoid sinus, maxillary sinus, and the sphenoid sinus. Okay, ethmoidal sinuses, frontal sinus. The maxillary sinus is actually on the lateral side of the nasal cavity, so you can only see it opening here, and sphenoidal sinus. Okay, drainage of paranasal sinuses are still aligned by mucous membrane. They produce mucus, which then drain out to the opening of each sinus. All right. If we have no any pathological conditions, the ciliary movement of columnar cells that covering the membrane will have help to drain the mucus that is present in the sinuses. But when we have flu or sinusitis, where the secretion is exceeding the normal amount, so we might need to actively suck the mucus from our nose. So when we do nose blowing action, this is active suction of the mucus produced in the paranasal sinuses. All right, now we go to the opening of the sphenoid sinus. This sphenoid sinus is open into this ethmoidal recess. The recess between the ethmoidal bone and the sphenoid. An opening is there. Okay, for the frontal sinus, it open into the middle nasal meatus, as I mentioned before, through the frontonasal duct. Okay, it's don't drain directly to the middle nasal meatus, but they drain through a passageway known as frontonasal duct. And then the lateral to the nasal cavity, the maxillary sinus, they open into the middle nasal meatus too. And then, okay, the clear picture showing the maxillary sinus that's located on each side of the nasal cavity. They open into the middle nasal meatus. All right, and up here you have the ethmoidal sinuses, interior and posterior cells. Okay, these are cells of ethmoidal sinuses. they drain into all two meatus that present in the lateral wall of the nasal cavity. For the anterior ethmoidal sinus, they drain into the middle nasal meatus or drain and open into the middle nasal meatus. For middle ethmoidal sinuses, they open into the middle nasal meatus too. While for the posterior ethmoidal sinus, they drain into the superior nasal meatus. Well, these are all the side of the opening of the sphenoidal sinuses. Okay, I think that's all. I think we already covered the nose, the external nose. Okay, what is important in external nose is actually the well, at least you know which one is the dorsum, which one is the nares and the alar part of the external nose, and you have learned the blood supply of the external nose, particularly the little's area, but the little's area and some structure that form the external nose, whether it is um, skeletal or bony structure, and then we learn about the middle and lateral nasal cavity, nasal wall of medial and lateral nasal wall of the nasal cavity. So you have to know what are the three different regions present in the nasal cavity, and then all which structure that form the elevation in the lateral nasal wall, and the presence of the ophthalmic area. Sorry, olfactory area. Sorry, yeah, olfactory area that is contain the sensory end of the olfactory nerve, one of your our cranial nerve, and some facts about the paranasal sinuses. What you have to know is the where are each of these sinuses drain into, whether it is drain into the superior nasal meatus, middle nasal meatus, or anywhere else. Okay, I think that's all. I wish you all the best. And if you have any question, you can always email me at any time. Thank you so much for your attention.